It's been clear from the very beginning that the fitment of orthotics and prosthetics is helpful to the patient. It improves their mobility, probably improves their health, probably leads to less health care and less emergency room visits. Historically, payers have been somewhat reluctant to pay for prosthetics and orthotics, primarily because there's an upfront investment and they're not confident that they'll get their investment returned in the long run, which in a certain way is unfair, because if you get a heart procedure, you don't ask whether you get a return on it. You just do the heart procedure because it's a necessary medical procedure. So I think there's a certain discrimination in the marketplace for prosthetics and orthotics. And what we found is that the payer does indeed save money over a 12 to 18-month time period. We found between a 1% and 10% savings dependent upon the devices, and for the prosthetics we found essentially a break even over a 12-month time period. Very powerful finding. In this study we adjusted very carefully for the kinds of patients that were treated as opposed to those that weren't treated. So when we made the comparisons, they were likes to likes. It's as if we did a randomized clinical trial and we compared people at the end of the day who had the fitment and those that didn't. And using powerful statistical techniques, we were able to say with some certainty that the findings we had are valid and appropriate and true. The study findings are certainly a win-win proposition. The patients are much better off. They're using less hospital care. They're using less emergency room care. Hospitals are places you just don't want to go unless you absolutely have to. And what we've shown with our study is that hospitals are used less by people who are fitted to these devices. From the insurer's point of view, the insurance payer's point of view, it's essentially a save 1 to 10% proposition to break even. So they're coming out of this financially a little better off, but their patients are much better off.